Yeah, good afternoon. My name is Heide Preuss, and I'm representing Mamazone Women and Research Against Breast Cancer in Germany, as well as ECPC, where I'm a board member since its foundation in 2003. And I'm very happy to be here today and to speak to you on behalf of the cancer patients. In 1995, when the European Medicines Agency started its work with centralized and decentralized marketing authorization procedures, I was diagnosed with breast cancer. Due to my profession and my work in regulatory affairs of a pharmaceutical company, I already had some basic knowledge and information about medicines and treatment. The mammography and sonography did not show satisfactory results. Only the MRI confirmed the suspicion of cancer at the end. At this time, nearly all women were treated with CMF. Since this time, I know that cancer research is very important, as breast cancer is a chronic disease and can be a never-ending story. My cancer story is as follows. After my first diagnosis in 1995, I had the first recurrence of my cancer in 1999, and last year in 2009, the second recurrence with a lymph node in the axilla and bone metastasis in my right hip. During the last 15 years, a lot of new therapies have been developed, as for example, chemotherapies, monoclonal antibodies, aromatase inhibitors, Herceptin, etc. So I was very lucky to benefit from the new possibilities of treatment, being aware that my disease now is incurable. And I do very much hope that also in the future new therapies will be developed to give cancer patients in all member states of the European Union more and better perspectives on longer survival. In my opinion, cancer research should also be carried forward for rare diseases and drugs for children. These patients are disadvantaged as there are less therapy options available and dosages for children are less investigated in clinical trials. As a consequence, the clinical trials should be facilitated as the current Clinical Trials Directive has a great impact because of a much higher workload and much higher cost to set up trials. As a member of the EMA Working Party with patients and consumers organizations, I recognize the great involvement of patients into EMA activities to improve the situation of patients in Europe, also concerning the access to drugs and treatments. I very much hope that you all will support FACE further on. Thank you very much for your attention.